Every day, millions of older adults take steps they believe are protecting their health. Annual checkups, routine scans, common medications, simple procedures. You trust your doctor, you follow instructions, you check the boxes. But what if I told you that some of the very things you're doing to stay healthy might actually be putting your brain at serious risk overnight? It sounds unbelievable, doesn't it? How can a simple scan, a heart test, or even a sleeping pill lead to a stroke? The truth is, after age 60, your body doesn't respond the same. Blood vessels stiffen, circulation changes, and medications, procedures, and screenings that seem routine in younger adults can quietly trigger blood pressure spikes, clot formation, and reduce blood flow to the brain, sometimes within hours. And here's the most frightening part: no one warns you. Not your pharmacist, not the pamphlet in the clinic, not even your doctor. In this video, I'll reveal 8 everyday medical tests and treatments that could silently raise your stroke risk, often within 24 hours. I'll show you how to spot the dangers, ask smarter questions, and most importantly, how to protect your brain. Stay with me, because what you learn next could save your life. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. CT scan with contrast dye, a hidden stroke, risk that can strike overnight. Most seniors I've cared for over the years believe that getting regular imaging scans, especially a CT scan with contrast, is simply part of staying on top of their health. And in many cases, it is. These scans can detect tumors, internal bleeding, or hidden inflammation. But what very few older adults realize, and what deeply concerns me as a brain doctor, is that this seemingly routine test can sometimes create the very emergency it was meant to prevent. Let me explain. When you go in for a CT scan with contrast, a dye is injected into your veins. This dye, often iodine-based, helps highlight your organs and blood vessels more clearly on the scan. You may have felt it before. That warm rush or metallic taste, a sign the contrast agent is doing its job. But what your doctor may not warn you about, especially if you're over 65, is how this dye interacts with an aging cardiovascular system. For seniors with high blood pressure, narrowed arteries, fragile vessel walls, or impaired kidney function, the body may react strongly to the sudden influx of contrast dye. The stress on the system can trigger a chain reaction: elevated blood pressure, inflammation of vessel walls, or vasospasm, which is a dangerous tightening of blood vessels, especially in the brain. But here's the most terrifying part: it can form blood clots. The dye may thicken the blood slightly or disturb the delicate balance in an already compromised vessel, giving rise to a small clot that travels silently to the brain. And if that clot lodges in a narrow cerebral artery, the result is often a stroke, not a week later, not months later, but sometimes the very next morning. Let me share a real story. Mr. Harold Thompson, a warm-hearted 82-year-old Vietnam veteran from Wisconsin, came to my clinic after mild abdominal discomfort. He was active, sharp, and had been caring for his wife who had early dementia. His primary care physician recommended a contrast-enhanced CT scan of the abdomen just to be sure. The scan went smoothly. Harold left the hospital that afternoon, went home, and even mowed a small section of his lawn. But the next morning, his wife found him on the floor. He couldn't move his left arm. He was confused and slurring his words. We confirmed it was a minor ischemic stroke, caused by a small clot that had lodged in his middle cerebral artery. His kidney labs came back borderline. His blood pressure, already on the high side, had spiked to 185, 110 overnight, likely a reaction to the contrast injection. The dye, combined with his underlying vascular fragility, had set the stage for a clot to form and travel to the brain. Harold survived, but with lingering weakness on his left side and months of therapy ahead. What pained me most wasn't just his stroke, it was knowing this might have been preventable. You see, this is more common than most people realize. A 2018 study in the Journal of Vascular and Interventional Radiology found that adults over 65 who received contrast enhanced CT scans had a statistically higher incidence of vascular events within 72 hours, particularly among those with hypertension, cardiovascular disease, or kidney dysfunction. And yet, many seniors are told these scans are routine. That's the danger. When something becomes routine, we stop asking questions. We stop pausing to consider, is this safe for me right now? So what can you do? Before agreeing to a contrast CT, especially if you're over 60, ask your doctor. Is this scan absolutely necessary? Can we do it without contrast? What's my kidney function like? Do I have any vascular risks that could complicate things? If you've had previous reactions to imaging, or if you're on blood pressure meds, blood thinners, or have any history of heart or kidney issues, your doctor needs to know. Because a 5-minute scan might just save your life. But if ordered without caution, it could take it. And remember, a stroke doesn't always announce itself with drama. Sometimes it's a small clot, a brief moment of confusion, a stumble, a night of poor sleep you dismiss, and by morning the damage is done. Now, what if I told you that another test, one many doctors order just to check the heart, could push your blood pressure so high it tears a tiny blood vessel in your brain? Let's talk about the treadmill stress test and why it might be lighting a fuse without you even knowing. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Treadmill stress test. The harmless heart exam that could trigger a stroke overnight. If you're over 65, chances are your doctor has recommended a treadmill stress test at some point, maybe even recently. On paper, it seems like a smart precaution. After all, what's the harm in walking on a treadmill while your heart is monitored? But as a brain doctor who spent decades working with older adults, I need to tell you the truth. For many seniors, this routine heart test can quietly push the body past its limit and even trigger a stroke just hours later. I know that sounds alarming, but I've seen it happen. And the risks aren't just theoretical, they're rooted in real physiology that changes with age. Here's what's really happening during a treadmill stress test. You're hooked up to a heart monitor and gradually asked to walk and then jog while your heart is pushed to work harder. Your heart rate increases. Your blood pressure surges. Your arteries are forced to expand and contract more rapidly than they usually do. That may be fine for a 35-year-old marathon runner, but for a 70 or 80-year-old with stiffened blood vessels, a history of hypertension, or undiagnosed plaque buildup in the arteries, that sudden physical stress is like shaking a fragile glass bottle and hoping it doesn't crack. Now, here's where the stroke risk becomes terrifyingly real. That pressure can cause tiny blood clots to form, especially in arteries that already have narrowing or damage. When the blood moves faster, the turbulence near plaques or vessel irregularities increases. And those little clots can break loose. They travel quickly. And if even one small clot reaches the brain, it can block blood flow to a region of brain tissue. Within minutes, brain cells begin to die. And you may not even realize it until hours later, after the test is over, once you're home and resting. Let me tell you about Margaret L., a 74-year-old retired school teacher from Columbus, Ohio, and one of my former patients. Margaret had lived with high blood pressure for years. She managed it with medication and led an otherwise peaceful life. At her annual checkup, her doctor suggested a treadmill stress test, just to make sure the heart is holding up. Margaret agreed, thinking it was a wise move. She handled the first few minutes of the treadmill fine, but as the technician increased the speed and incline, Margaret began feeling dizzy and short of breath. The test was stopped before completion. She sat for a while, felt better, and went home. That night, she woke up with a strange numbness in her left arm. By morning, she couldn't grip her coffee mug, and her speech had a slight slur. Her daughter rushed her to the ER, and the scans confirmed it. Margaret had suffered a minor ischemic stroke during the night. The likely culprit? A blood clot formed during the stress test, possibly due to a spike in blood pressure and turbulence in one of her cerebral arteries. Her vessels were already vulnerable. The test just tipped the balance. What makes this story so haunting is that Margaret had no chest pain, no heart symptoms, and no complaints leading up to the test. She didn't need it. It wasn't to diagnose a condition, but it was routine. And that routine test cost her a piece of her independence. Today, she still struggles with mild speech issues and fatigue, and she always tells others, ask questions before you agree to anything. Unfortunately, Margaret's story is not unique. A 2020 study published in the American Journal of Cardiology analyzed over 300 patients over the age of 65 who underwent treadmill stress tests. Alarmingly, nearly 7% experienced cardiovascular complications, from arrhythmias to blood pressure spikes, within hours or days of testing. And those with a history of vascular issues were at the highest risk. That's why I urge every senior watching this. If you're not currently having chest pain, shortness of breath, or fatigue, ask your doctor if the treadmill test is truly necessary. There are often safer alternatives, like a nuclear stress test that uses medication to simulate exercise without putting physical strain on your body, or even a resting echocardiogram to assess heart function more gently. And always remember, you are not too old to speak up. Ask. Is this test necessary for someone like me? Are there safer options given my blood pressure and heart history? What are the actual risks of doing this test now versus waiting? Because after 60, your body doesn't bounce back the same way. Your arteries are thinner. Your vessels less flexible. The risk of forming a blood clot or rupturing a delicate vessel goes up sharply with even moderate physical stress. And the cruelest part, the test may end in a clean report, normal heart function, while a clot is silently forming, moving, waiting to strike when you're no longer under medical supervision. So be cautious, be informed, and know that sometimes the most dangerous part of aging isn't what you feel. It's what you don't feel until it's too late. But what if I told you that even when you're asleep on an exam table, sedated, unaware, your brain could still be in danger? The next test might seem harmless, but for many seniors, it opens the door to internal bleeding, blood pressure drops, and silent strokes. Let's talk about endoscopy and why it may be doing more harm than good. 3. Sedated endoscopy or colonoscopy, the silent procedure that may trigger a stroke overnight. As a brain doctor who has spent decades treating seniors, I've learned that what you don't feel is often more dangerous than what you do. This couldn't be truer when it comes to sedated procedures like endoscopy or colonoscopy. Most older adults think of these tests as routine, just part of responsible aging. Your doctor recommends it and you agree. After all, it's just a quick look inside, right? But what if I told you that this very test, especially when done under sedation, could quietly raise your risk of stroke, even while you sleep that night? It doesn't happen to everyone, but when it does, it's often without warning, and it's devastating. Here's the truth many seniors never hear. The combination of sedation, blood pressure changes, and medications like blood thinners can create the perfect storm for a blood clot to form and travel to the brain. And the worst part? You may not notice anything until hours later, or even the next morning, when your speech is suddenly slurred or your balance feels off, and you're left asking, "What just happened to me?" Let me take you into the life of one of my patients, Eleanor, a 76-year-old widow from New Hampshire. She had always been diligent about her health. She walked every morning, took her medications on time, and followed all her doctor's advice. When her gastroenterologist suggested a routine colonoscopy, just to check since it had been a few years, she agreed without hesitation. The procedure itself went smoothly. Eleanor was sedated with a standard mix of midazolam and fentanyl. She recovered in the clinic and was sent home with her daughter. But what they didn't know was that Eleanor's low blood pressure during sedation, combined with her daily aspirin use, had created just the right environment for a small clot to form. That night, Eleanor felt dizzy but brushed it off as side effects from the medication. The next morning, she couldn't grip her hairbrush. Her daughter rushed her to the hospital, where scans revealed a mild ischemic stroke. A clot had blocked a small artery in her brain. It didn't take much. Just a drop in blood flow during the procedure, an aspirin-thinned bloodstream, and one rogue clot. Eleanor was lucky. Her stroke was mild, and with therapy, she regained most of her strength. But her confidence was never the same, and neither was her daughter's trust in routine procedures. Sadly, Eleanor's case is not unusual. A 2021 review in the Gastrointestinal Endoscopy Journal analyzed thousands of patients over 65 undergoing sedated endoscopies. They found a significant increase in transient ischemic attacks, TIAs, or mini strokes within 72 hours of the procedure, particularly in those taking blood thinners or with a history of cardiovascular disease. As we age, our body's ability to regulate blood pressure during sedation becomes more fragile. Sedatives lower the heart rate and blood pressure, reducing circulation to the brain. And if you're on medications like Plavix, aspirin, or warfarin, which many seniors are, your blood may not clot normally. The result? Microclots can form, travel, and block critical arteries, sometimes silently, until the damage is done. Here's the hardest part for many older adults to accept. You might not even need the procedure in the first place. If you have no symptoms, no pain, no bleeding, no family history of cancer, the benefits of a sedated scope may not outweigh the risks. But we live in a medical culture where, just to be safe, can sometimes do more harm than good. So before you agree to your next endoscopy or colonoscopy, please ask your doctor, do I really need this now? Are there safer alternatives like non-sedated options or stool-based screening tests? Should I stop my blood thinner beforehand? What are the risks if I don't? You have every right to understand not just the benefits, but the risks, especially if your body has already been through decades of heart disease, medication, and silent wear and tear. Because after age 65, even a brief dip in blood pressure under anesthesia, combined with a bloodstream that clots differently, can be all it takes to change your life overnight. And what's worse, most families don't connect the dots. They blame age or fatigue or stress. But it was the procedure. It was the sedation. It was the hidden risk no one explained. Now, what if I told you that another scan, one that doesn't involve a treadmill or even sedation, could leave behind tiny traces of heavy metal in your brain and possibly affect your memory, your balance, even your breath. Let's talk about MRIs with contrast and the quiet danger most seniors are never told about. If you're still watching and finding these insights helpful, please comment number one below to let me know you're with me. Now let's move on to point number 2. 4. MRI with contrast dye. The scan that can leave heavy metals in your brain and trigger a stroke overnight. For most seniors, hearing the words MRI scan brings a sense of trust. After all, MRIs are high-tech, non-invasive, and capable of detecting what X-rays and CT scans might miss. But what if I told you that, for older adults, one specific type of MRI, the kind that uses contrast dye, might quietly leave behind something toxic inside your body, something that doesn't always go away, and in some cases can trigger a stroke just hours later? That may sound dramatic, but it's a reality I've seen in my own patients. And the risk becomes far more serious when you factor in age-related kidney decline, hidden vascular problems, and the delicate neurological balance that seniors live with every day. Let me explain. When your doctor orders an MRI with contrast, they're trying to see clearer, sharper images, often of blood vessels, soft tissues, or potential tumors. To do this, they inject a contrast agent into your bloodstream, most commonly containing gadolinium, a heavy metal. The idea is that your kidneys will filter it out shortly after the scan, and you'll be just fine. But here's the problem. As we age, kidney function naturally decreases, even if we've never been diagnosed with kidney disease. That means the body might not eliminate gadolinium efficiently. Instead of leaving your body, it lingers and sometimes settles in the brain. In many seniors, this retention may cause no obvious symptoms, but in others, especially those with vascular fragility or mild cognitive decline, it may quietly trigger a storm, confusion, dizziness, unsteady gait, blurred vision, or worse, a blood clot that travels to the brain and causes a stroke. You might think that sounds rare, but let me tell you about Harold M., a 79-year-old Navy veteran from Arizona and one of my longtime patients. Harold had been struggling with lower back pain and was sent for an MRI with contrast to check for nerve damage. No one mentioned any special warnings. No one checked his kidney function. He was told it's completely safe. The MRI was done in the afternoon. Harold went home feeling a little lightheaded, but assumed it was just stress or dehydration. The next morning, he couldn't stand up without falling over. He was confused, disoriented, and couldn't recall his grandson's name. His daughter brought him to the emergency room, and after several tests, it was confirmed Harold had suffered a mild ischemic stroke. Further lab results showed his kidney function was compromised, likely stage 3 chronic kidney disease undiagnosed. His body had not eliminated the gadolinium efficiently. A combination of vascular irritation, pre-existing hypertension, and impaired filtration had allowed a clot to form and travel to his brain overnight. This wasn't just bad luck. It was avoidable. What most seniors aren't told is that gadolinium is a neurotoxin when it builds up in the body. In some people, it has been linked to a rare but devastating condition called nephrogenic systemic fibrosis, NSF, which causes tightening of the skin, joint pain, and organ damage. But even short of NSF, retained gadolinium in the brain has been found in autopsies and linked to memory issues, balance problems, and neurological changes, particularly in those with poor kidney function. The most chilling part? Many seniors experience stroke-like symptoms within 72 hours of their contrast-enhanced MRI and never realize there's a connection. They think they're just feeling off. But the truth is, it forms blood clots. It disturbs the blood-brain barrier. It changes the internal chemistry of the most delicate organ in your body. your brain. So what can you do to protect yourself? Before undergoing an MRI with contrast, ask your doctor directly. Is this contrast really necessary? Can we try a non-contrast MRI or a different scan first? Can you check my kidney function before the procedure? It's a simple blood test called a GFR, glomerular filtration rate, and it could spare you from unnecessary risk. And if you've ever had a strange reaction to previous imaging tests, dizziness, or mental fog afterward, say something. Your experience might be the warning sign your body is trying to give. Because no one should suffer a stroke from a scan meant to help them, not when the risks can be predicted, not when they can be prevented. Harold survived, but he never fully recovered. He now lives with mild cognitive deficits and struggles to follow conversations. His daughter told me through tears, "If we had just known to ask for a kidney test, we would have waited." And now I want to ask you something. What if the most gentle scan of all, a quick, non-invasive ultrasound of the neck, could steer you toward risky surgery you didn't even need? In the next section, let's talk about the carotid artery ultrasound and why it may be quietly leading thousands of seniors down the wrong path, straight into the operating room. 5. Carotid artery ultrasound, the innocent test that may lead to a stroke-triggering surgery you never needed. It's one of the most common screenings offered to older adults, especially during community health fairs or annual physicals. The carotid artery ultrasound seems harmless. No needles, no sedation, just a quick scan of your neck to see if your arteries are clear. Many seniors are told it's a great preventive tool to reduce stroke risk. But what most aren't told is this. For people without symptoms, this simple test may set off a chain reaction that leads directly to an unnecessary and dangerous surgery. A surgery that, in some cases, causes the very stroke it was meant to prevent. As a brain doctor, I've seen the unintended consequences firsthand. This is not fear-mongering. It's a warning, born from the quiet tragedies I've seen unfold in people who trusted they were just being proactive. Here's how it happens. Your doctor or screening program performs a carotid ultrasound, a test that uses sound waves to look at the two main arteries in your neck that carry blood to your brain. They find some narrowing, maybe 50% or 60%. That sounds scary, right? Plaque buildup in an artery? That must be dangerous. But here's the truth. Some narrowing of the carotid arteries is normal as we age. In many cases, these plaques are stable and not likely to rupture. They don't cause symptoms, and they don't automatically mean you're headed for a stroke. In fact, most people with mild to moderate narrowing are safer being managed with medication and lifestyle, not surgery. And yet, this test often leads to a referral to a vascular surgeon. And once you're in that office, the pressure begins. You're told about procedures like carotid endarterectomy or stenting, operations meant to clean out or open up the artery. But what you may not be told clearly is that these procedures come with real stroke risk, especially in older adults with fragile arteries. Let me share the story of Helen J., an 82-year-old widow from Pennsylvania and one of my longtime patients. She went in for a routine physical. She had no symptoms, no dizziness, no vision problems, no weakness, nothing to suggest poor blood flow to her brain. But her doctor offered a free carotid screening just to be safe. The test showed a 65% narrowing in her left carotid artery. Within a week, she was scheduled for a surgical cleaning of the artery, an endarterectomy. She was told the procedure was safe and would prevent a stroke. But during the surgery, a small clot formed and traveled to her brain. It caused a minor stroke, right there on the operating table. Helen survived, but her life changed forever. She was left with partial weakness on her right side and difficulty with coordination. She told me through tears, "I didn't even feel sick. If they hadn't done that scan, I would have walked out just fine." Sadly, she's not alone. A major study in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid narrowing but no symptoms. The findings were clear. Surgery did not significantly lower stroke risk compared to medication and healthy lifestyle changes. Worse, a small but real percentage of patients actually experienced strokes as a direct result of the surgical procedure. And yes, these strokes often happen within 24-48 hours after surgery. Why? Because the mechanical intervention can dislodge plaque or trigger blood clots, which then travel quickly to the brain. The intention is prevention, but the outcome can be devastating. You see, it forms blood clots, not the scan itself, but the chain of decisions that scan sets in motion. And for many older adults, the body is already on a tightrope. Fragile vessels, fluctuating blood pressure, slower recovery. One procedure can tip the balance. So what should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, ask, "What are we looking for? And what would we do if we found something? Would this change my treatment or just add worry? If narrowing is found, are there non-surgical options? And if you've already had a scan that showed some narrowing, don't panic. Ask for a second opinion. Ask whether repeat scans can be used to monitor the condition over time instead of rushing into surgery. Because after age 60, the decision to operate on blood vessels near the brain must never be taken lightly. You deserve full information, not fear-based persuasion. And you deserve to know that routine testing doesn't always mean safe. Now, what if I told you there's another test that doesn't require a hospital, a machine, or even a needle, but it's performed every month in eye clinics across the country, and it may quietly spike your blood pressure just enough to send a clot to your brain? Let's talk about eye injections for macular degeneration and the hidden stroke risks no one is warning seniors about. 6. Eye injections for macular degeneration. The tiny needle that could trigger a stroke overnight. When most people think about the risks of stroke, they picture high blood pressure, smoking, or clogged arteries and not a needle in the eye. But as a brain doctor who has treated hundreds of seniors, I can tell you that some of the most dangerous events happen where you'd least expect them. And for millions of older Americans receiving monthly injections for macular degeneration, the danger may already be happening silently and within hours of the procedure. Macular degeneration, especially the wet type, is one of the leading causes of vision loss in people over 65. The standard treatment is an injection into the eye, usually with a medication that blocks VEGF, a protein that causes abnormal blood vessel growth. Drugs like Lucentis, Eylea, and Avastin are used widely and can be highly effective at preserving vision. But here's what most seniors are never told. Those very medications can cause sudden spikes in blood pressure, sometimes within minutes of the injection. These blood pressure surges are well documented, especially in patients with pre-existing hypertension or vascular disease. In a younger, healthier person, the body might adjust. But for someone over 70 with fragile arteries, a slightly thickened heart wall, or narrowed vessels in the brain, that spike can create just enough stress to form a clot and send it directly to the brain. That's right, it forms blood clots. You won't feel it during the injection. You may not even notice anything unusual afterward. But that night or the next morning, something shifts. Your speech becomes slurred. You drop your fork. You feel dizzy. And before you even realize what's happening, the stroke has already begun. Let me tell you about Walter P., a 78-year-old retired postal worker from Missouri, and one of my patients. He'd been receiving injections for macular degeneration for nearly 2 years. They were helping. His vision was stable, and he was grateful. But one evening, after a routine injection that morning, Walter began feeling unusually tired and nauseated. He went to bed early. The next morning, he couldn't get out of bed. His wife noticed his face looked uneven and he couldn't move his right arm. At the hospital, scans revealed an ischemic stroke in the left side of his brain, caused by a blood clot that likely formed due to a blood pressure spike following the injection. Walter had a history of controlled hypertension, and though he wasn't considered high risk, the injection tipped the scales. Sadly, Walter's stroke was moderate. He lost some motor control and now struggles with simple tasks like writing and getting dressed. His vision was saved, but at a terrible price. And he's not alone. Studies published in journals like Ophthalmology and the American Journal of Hypertension have shown that anti-VEGF-I injections can lead to systemic vascular events, including transient ischemic attacks and full-blown strokes, particularly in older adults and those with cardiovascular histories. Yet this risk is rarely explained in full to patients. Why? Because the procedure feels localized, routine, and small. But the impact on your entire vascular system is very real. These medications don't just stay in the eye. They enter the bloodstream, even in small amounts, and can affect blood vessel behavior across the entire body, including the brain. So what can you do? If you're receiving these injections or being told to start, speak up. Ask. How will this affect my blood pressure? Have I had any blood pressure spikes in previous visits? Is there a safer schedule or dose for someone my age? Can I be monitored more closely immediately after the injection? And if you've ever experienced dizziness, vision changes beyond the eye, or confusion after an injection, tell your doctor immediately. It may not just be fatigue. It may be your body warning you. For many seniors, these injections are necessary, but necessity should never mean blind acceptance. You have the right to understand every risk, no matter how rare someone says it is. Because when it happens to you, it's not rare. It's personal. It's life-changing. Walter told me weeks into rehab, "I wish someone had told me that this little shot could do something so big to my brain." Now, what if I told you that there's another silent stroke risk hiding not in a hospital but right in your own bedroom while you sleep? In the next section, we'll talk about at-home sleep apnea tests and how false reassurance from these devices could be putting your brain in danger every single night. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 7. 7. At-home sleep apnea tests. The silent stroke risk lurking while you sleep. Most older adults think of sleep as a time of rest, a time when the body recovers and restores itself. But what if during those very hours of sleep your brain wasn't getting enough oxygen? What if each breathless pause in the night was triggering silent damage, and no one, not even your doctor, noticed because your at-home sleep apnea test said everything was fine? As a brain doctor, I've seen the devastating effects of undiagnosed or misdiagnosed sleep apnea, particularly in seniors. One of the most concerning trends in recent years is the increasing reliance on at-home sleep apnea testing as a convenient and low-cost way to screen for a dangerous condition that, when overlooked, can cause a stroke overnight. Sleep apnea is far from benign. When you stop breathing for short periods during sleep, your blood oxygen levels drop, sometimes significantly. This puts tremendous strain on your heart, increases blood pressure, disrupts circulation, and over time, leads to the formation of blood clots in vulnerable vessels. These clots don't always cause immediate symptoms, But all it takes is one to break free, travel to the brain, and block an artery. It's why I always tell my senior patients, sleep apnea is not just about snoring, it's about brain protection. And here's where the danger of at-home testing comes in. These tests, often mailed to patients or sent home from clinics, use basic sensors strapped to your finger and chest. They measure breathing patterns and oxygen levels, but they lack the depth and sensitivity of in-lab sleep studies. They don't monitor brain activity. They often miss mild but harmful forms of apnea, and worst of all, they may give a false sense of security. That's what happened to Frank D., a 73-year-old retired contractor from Minnesota and one of my longtime patients. Frank had been waking up tired for years. His wife noticed he would occasionally stop breathing at night and gasp for air. His doctor sent him home with a sleep apnea test kit, one that fit around his chest and finger, and recorded data overnight. The results came back as mild apnea, not concerning. No treatment was recommended. 3 weeks later, Frank woke up one morning feeling confused. His right arm was weak, and he couldn't remember how to use his coffee machine, the one he'd used every morning for a decade. His wife rushed him to the hospital, where we confirmed he'd had an early morning ischemic stroke, likely sometime during the night. Further evaluation revealed that Frank had moderate to severe sleep apnea. The at-home test had missed it. His blood pressure had been spiking during episodes of oxygen loss, and a small clot had likely formed and traveled to his brain. It was a clot that could have been prevented if the diagnosis had been accurate, if treatment, like a CPAP machine, had been started. Frank recovered most of his function, but his short-term memory remains impaired. He now relies on written reminders to get through the day. His story is not unique. Research shows that at-home sleep apnea tests may miss up to 30% of clinically significant cases, especially in seniors who have silent apnea. No loud snoring, no dramatic gasping, just quiet drops in oxygen that go unnoticed. And these drops, they're what weaken the blood vessels and set the stage for clot formation. In the most dangerous time of all, early morning hours, right before waking, when blood pressure naturally begins to rise and the brain is at peak vulnerability. If you've had an at-home sleep test and it came back normal, but you're still waking up tired with headaches, foggy memory, or unexplained high blood pressure, don't assume you're fine. Ask for an in-lab sleep study where your brain activity, oxygen levels, heart rhythm, and limb movement are all tracked in real time. Because the truth is, many strokes happen not during the chaos of the day, but quietly in the darkness of night, when no one is watching and the brain is starved of what it needs most, oxygen and blood flow. Frank's wife told me afterward, if we had known how serious sleep apnea really was, we never would have trusted that home test. So please, if you're over 60, have high blood pressure, diabetes, or any signs of poor sleep, take sleep apnea seriously. It's not about snoring, it's about survival. Now, imagine being told you need dental work, a common procedure, nothing major. You sit back in the chair, they administer sedation, and the next day, something is terribly wrong. In the next section, we'll talk about dental procedures with sedation and how even simple visits can carry silent, stroke-triggering risks that almost no one talks about. 8. Dental procedures with sedation. The hidden stroke risk sitting in your dentist's chair. When you think about going to the dentist, you probably imagine routine cleanings, maybe a filling, or even something more involved like an implant or a root canal. It's not pleasant, but for most seniors, it feels safe, especially with sedation available to ease the discomfort. But what very few people over the age of 60 realize is that dental sedation, even for minor procedures, can quietly set off a chain reaction in your body. One that, under the right or rather wrong circumstances, may lead to a blood clot forming and a stroke just hours later. As a brain doctor, this is one of the most surprising and overlooked risks I've come to witness in older patients. We've spent years warning about heart disease, cholesterol, and high blood pressure, but we rarely ask the question, what happens when we sedate someone with fragile vessels, irregular heart rhythms, or clotting issues, even for just an hour? Let me explain how it works. Dental sedation, whether it's conscious sedation like nitrous oxide, laughing gas, oral sedatives like diazepam, or intravenous medications like midazolam, all have a profound effect on your cardiovascular system. They slow down your breathing, they lower your blood pressure, they alter your heart rhythm. In a younger, resilient patient, this might not matter, but in a senior with atrial fibrillation, stiff arteries, or on blood thinners, even a slight change in blood flow or pressure can cause blood to pool in the wrong place. And when blood pools, it forms clots. It doesn't always happen immediately. That's the terrifying part. You leave the dentist's office groggy but fine. You take a nap. But overnight or the next morning, you start feeling off. Maybe a numbness in the hand, a weakness in one leg, or your words begin to slur. That's not drowsiness. That's not aging. That's a clot that's traveled to the brain. I'll never forget Norma Age, a sweet 81-year-old retired piano teacher from Charleston, South Carolina. Norma had no serious health issues except for mild hypertension and was still giving lessons 3 times a week. She went in for a routine dental procedure, a bridge replacement, and chose to be lightly sedated to avoid discomfort. The dentist told her daughter it was safe and standard. And it was, until it wasn't. Norma returned home that afternoon and napped for several hours. The next morning, she couldn't remember her address. Her speech was garbled. She had suffered a mild ischemic stroke, confirmed by MRI, likely caused by a clot that formed during or shortly after the procedure, exacerbated by a drop in blood pressure and slow blood flow during sedation. Norma survived, but her memory and coordination never fully returned. She gave up piano teaching, something that had been her joy for over 60 years. And here's the most heartbreaking part. It could have been avoided. With better screening, with more communication between her dentist and primary care doctor, and with greater awareness of the risks that sedation can pose to a brain already at risk, Norma might still be playing Bach and Beethoven today. Dentists aren't to blame. Most do their best to protect patients. But the system often fails to consider the whole person, especially the unique vulnerabilities of seniors. No one asked Norma if she had experienced dizziness before. No one checked her recent blood pressure trends. No one stopped to think that light sedation for a dental procedure might do more than calm her nerves. It might change her life forever. So, if you're over 65 and preparing for a dental procedure with sedation, I urge you to ask, is sedation absolutely necessary, or can we do this with local anesthetic? Has my heart condition or medication history been reviewed? Will my blood pressure and oxygen levels be monitored throughout? Have my doctors been informed? Don't be afraid to push back. Your life, your brain, is worth the extra caution. Because a dentist's chair may feel far from a hospital bed, but for someone with vulnerable circulation, 1 hour of light sedation could be all it takes to tip the balance and form a clot that silently waits for nightfall. Norma told me later with tears in her eyes, I never thought something so small could change everything. And now, after 8 hidden risks, from hospital scans to bedtime breathing, you might be wondering, so what's the big picture? How do we protect ourselves in a world where even checkups can carry silent threats? In our final section, let's put it all together. The truth, the tools, and the questions every senior must ask before the next medical test. You do not want to miss this. When routine becomes risk, what every senior needs to know before their next medical test. If you've made it this far, it means you're someone who cares deeply about your health, and more importantly, about protecting the life you've built. That means something. It means you're paying attention not just to what medicine offers, but also to what it assumes. And those assumptions, especially when it comes to older adults, can be dangerous. You've now heard the 8 silent threats, tests and procedures that sound routine, harmless, even beneficial, yet, in certain bodies at a certain age, become something else entirely. A contrast dye meant to highlight an image can spike your blood pressure and form a clot. A treadmill stress test designed to test your heart can quietly tear a vessel in your brain. A sleep apnea test that's good enough might miss the very thing that's starving your brain of oxygen. And that dental procedure, that simple sedated moment, it can unravel decades of good health in a single night. These aren't accidents, they're oversights, and they happen because modern medicine, for all its brilliance, still operates under a system built for efficiency, not for nuance. It's a system that assumes your 75-year-old arteries will react like they did when you were 45. That sedation in an 80-year-old with low blood pressure is no different than in a 20-year-old college student. That testing more always equals catching more, when in truth, testing without context often creates more risk than reward. I say this not to scare you, but to empower you, because in my decades of working with older adults, I've seen a painful pattern. The stroke, the heart event, the cognitive decline. It doesn't come out of nowhere. It builds quietly. A bad reaction here, a missed symptom there. And often it all begins with a test they didn't really need, done without the right questions asked. Let me be blunt. You are not a checklist. You are not a lab value. You are not a generic patient being moved through a system of protocols. You are someone with history, with complexity, with medication interactions, past traumas, silent conditions, subtle changes only you and your family may notice. And because of that, you must, especially after the age of 60, take an active role in every medical decision. Ask more questions than feel comfortable. Slow the process down when it feels rushed. If a doctor says, let's run this test to be safe, ask, safe for who? Based on what risk? If someone tells you a side effect is rare, ask, rare in general or rare in people like me? Because when your health is involved, your voice must be the loudest one in the room. What can you do starting today? 1. Keep a detailed record of your health history, medications, allergies, and past reactions, and bring it to every appointment. 2. Never agree to a test, procedure, or injection without knowing why it's being done, what the alternatives are, and how your age or condition changes the risk. 3. Advocate for second opinions. Good doctors respect that. They don't fear it. 4. Trust your instincts. If something doesn't feel right, even if you can't explain it, speak up. 5. And finally, educate your spouse, your siblings, your community. Most strokes, most complications don't come from ignoring illness. They come from trusting too much and questioning too little. You've earned your place in life. You've raised families, built careers, served your communities. You've survived wars, losses, pandemics, and heartache. You deserve care that's just as wise and cautious as you are. So the next time you're handed a clipboard, told to sign before a scan, before a needle, before a test, just to be thorough, take a breath. Look them in the eye and ask, is this test really necessary for someone like me? What's the benefit? And what's the risk? Because those two questions may very well be the ones that save your life. And remember this: prevention is not about doing more. Prevention is about doing what matters at the right time for the right person in the right way. That person is you. Stay wise, stay vigilant, and stay alive. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.